Thank you, Dr. Hu. And we have one discussant. Dr. Jiang is going to give you could you keep your comments brief because we only have like 15 minutes left. And so we try to get a couple questions at the end. Dr. Hu.
Sure, could you hear me?
Yes.
Okay, let me share my screen. First, I want to congratulate Dr. Guan and Dr. Hu for doing such a wonderful job. When you look, listening to their talk, it's like we're looking at a gold mine of COVID-19 research because there are so many data sets and so many different types and models they have been collecting and sharing with us. I think that's great. So why is that? I want to talk this from a different angle, but also very brief. I don't want spend a whole lot of time here. So could you see my screen?
Yes.
Okay, I'm trying to share it in. Okay, yeah, so I want to look at from a broader perspective, why are we doing this? Collecting the data, doing the modeling, answering this from 6Ws. And we know that it's a global challenge. It touches on almost every aspect of our life and of what we do. For example, from medical services, from the cases, and to the social indications and human dynamics, economics, environmental and climate, and also on policy and administrations. Almost for every one of these, Dr. Guan, Dr. Hu, they have been collecting data sets and sharing that and also provide some examples. So, which is really a very broad, I think it's a gold mine for understanding and researching on the COVID-19. But let's come back from why are we doing this? What kind of questions do we want to answer? So first, obviously, is what? What are we trying to do? This is one example about we have so many people being infected, but what are the possibility of them getting to the hospital, or some of them may finally dead? So that's a fatality prediction. This is based on the data sets, in fact, Dr. Hu was introducing today. And this is the case data sets. And we have two data sets looked at, and there are several indications I want to talk about. First, we use the large data sets. As you see here, there's several millions of it. And this is a small data sets. As you see the difference, the smaller data sets has the better prediction results. In fact, for the last one, it's almost all of them are above 95%. So the indication of this is the quality of the data sets is really important. And the variable we collect is also very important. So those two are quite important. What are we collecting? The quantity and also the variability. I think that's very important. Another part is that when are we going to deal with this? I want to take a look at this. If we think back, when this happened in China, it's mainly in late January, February, and March. So this is when we have cases in China. So when we want to start COVID-19 in China, probably we want to focus this region. But if we want to go to start, let's say in the United States, and it's always coming up, and even now it's still going up. So now we probably want to start from mid of March. And all these data sets, in fact, are collected and shared by the team that Dr. Guan and Dr. Hu is working on. I think that's great. So this kind of research is very easily done by visualized by the data sets that they collected. So to answer when and where we can use the data sets they collected. And also when those data sets are collected, it's really not only by us, also for different countries. As you see here, there's about more than 30 countries. The data sets are collected, and there's more than half of the countries in the world. The data sets are being processed and collected and will be shared with the community. So that's great from that angle. Another part, this is also the last one, and which leads to several issues of modeling, is that what and how. So the question is that could we open the campus and the school system in the fall semester so that we can still have students coming back? There's a lot of issues to that because the parents and the teachers. They're pushing the students back to school because of the health of their mentality and also physical. But on the other side, we're experiencing the pandemic. So there's a lot of data sets we need, a lot of models we need to be collected and also integrated. This is an initial part about the campus simulation using the risk. If we add on some kind of policies, what kind of risk level are we going to get? And what is the zone of uncertainty here? So this part is the initial using the ABM and the mobility of the data sets, and also using different models to visualize the results. But this is not enough. In fact, we need to consider more, like Dr. Hu was talking about, workflow chaining. And we need to use those readily available modules to piece together so that we can integrate, for example, the population density in the building. Probably for this, we need the building internal modeling structure to fit into the answering this question. And also the percentage of students, how many of them are returning to campus. We need some kind of geospatial or geo data model to help answering this. And another question is that, do we have masks or low mask policy? So this should also be modeled and fit into the entire system. And there are many other parameters we need to put in, and we need those data sets to be collected and to be fitting into this. It's fortunate that from Dr. Hu's introduced and Dr. Guan's work, there's a lot of these data sets are already readily available there. So the last is who's going to collect from whom. In fact, everyone should be contributing to this. I'm especially glad to hear that Dr. Hu was talking about from the CHAMPS group. We're talking about producing training data sets or some kind of verification, validation data sets for the research. I know that from this series of talks, we have been talking about modelers from the field researchers, but from another angle, with the development of computing and AI, especially with the big data, we see that big data from Dr. Hu's introduced today, we could have using machine learning to do the modeling part. So in fact, in that kind of modeling using machine learning, almost everyone can contribute to that. And this is to show that we have about several hundred people helping with the work from all over the world, and every one of them are contributing to that. In order to get a good results, in fact, we need many people to collaborate and coming together to work together on this. So I just want to talk from those different W's. When we talk about data sets, when we talk about modeling, we need to focus on what are the problem we want to solve and who needs to get engaged to help collecting data, help validate, and help do the modeling and the simulation. So the engagement of them is really important. When we do this, we can refer back then to the 6W, and then we can probably have some good usage of the data sets and also have some good guidance on how to collect the data sets, models, and integrate those models to solve real world problems. Thank you.